Welcome to Better Health Today. I'm Dr. Emily Hart, and today we're tackling a topic that millions of men over 60 are concerned about, but few are discussing openly. How something as simple as the way you drink water can dramatically impact your erectile function. Now, I know what you're thinking. Water? Really? But stay with me, because what I'm about to share with you isn't just about drinking more water. It's about strategic hydration that works with your body's natural mechanisms to support healthy blood flow, vascular function, and yes, stronger, more reliable erections. After treating thousands of patients in my urology practice, I've seen firsthand how men who implement these hydration strategies experience remarkable improvements. And the best part? This costs you nothing, has zero side effects, and starts working within days. Let's start with something most men don't realize. After age 60, your body's thirst mechanism becomes significantly less sensitive. Studies show that older adults can be seriously dehydrated without feeling thirsty at all. You might be walking around right now, 2 or 3 glasses short of optimal hydration, and your body isn't even sending you the signal. Why does this matter for erections? Because an erection is fundamentally a hydraulic event. Your penis contains spongy tissue called the corpus cavernosum. When you're aroused, these tissues need to fill rapidly with blood. But here's the catch. If you're even mildly dehydrated, your blood volume decreases and your blood becomes thicker, more viscous. Try pumping thick honey through a straw versus water. That's essentially what your cardiovascular system is dealing with. When you're properly hydrated, your blood flows smoothly. Your blood vessels dilate more easily, and the entire mechanism of arousal works as it should. When you're dehydrated, everything becomes harder. Your heart has to work harder to pump thicker blood. Your blood vessels constrict, and achieving and maintaining an erection becomes more difficult. Now let me tell you about the biggest mistake I see men making. They drink water randomly throughout the day, usually only when they feel thirsty and often in small. Here's the method that works, and I want you to pay close attention because timing matters enormously. First thing in the morning, within 15 minutes of waking up, drink 16 to 20 ounces of water. Not coffee, not juice, pure water. Your body has been in a fasted, dehydrated state for 6 to 8 hours. Your blood is at its thickest right now. This morning hydration kickstarts your entire cardiovascular system, dilutes your blood, and sets you up for optimal circulation all day long. Here's what one of my patients told me after implementing just this one change. He said for the first time in 3 years, he was waking up with morning erections again. Why? Because morning erections are tied to REM sleep and healthy blood flow. When you rehydrate immediately upon waking, you're essentially giving your vascular system the resources it needs to function optimally during those early morning hours when testosterone is naturally highest. Now, throughout the day, you want to drink 8 ounces of water every 90 minutes to 2 hours. Not huge amounts all at once, but consistent, moderate intake. This maintains steady blood volume and keeps your blood at optimal viscosity. Think of it like maintaining consistent fuel in your car versus letting it run on empty and then overfilling the tank. Set alarms on your phone if you need to. Most of my patients do this for the first 2 weeks until it becomes automatic. This consistent intake prevents the peaks and valleys in hydration status that compromise vascular function. Here's another critical timing element that most urologists don't discuss. If you're planning intimate activity, you want to front-load your hydration in the hours leading up to it, but then taper off about 90 minutes before. Drink 12 to 16 ounces about 2 to 3 hours beforehand. This gives your body time to absorb the water, increase blood volume, and optimize circulation. But you're stopping 90 minutes before, so you're not dealing with a full bladder during intimacy, which can be distracting and uncomfortable. Sips. or they go the opposite direction and chug massive amounts all at once. Neither approach optimally supports erectile function. Now let's talk about what you're drinking. Temperature matters more than you'd think. Room temperature, or slightly cool water, is absorbed more quickly than ice-cold water. Ice-cold water can actually cause temporary vasoconstriction, a narrowing of blood vessels, which is the opposite of what we want for erectile function. Some of my patients have seen additional benefits from adding a small pinch of high-quality sea salt to their morning water. We're talking 1/8 of a teaspoon or less. This helps with electrolyte balance and water absorption at the cellular level. Your body doesn't just need water, it needs to actually absorb and utilize that water. Electrolytes facilitate this process. You should also consider the mineral content of your water. If you're drinking heavily filtered or distilled water, you're missing out on minerals like magnesium and potassium that support vascular health. Mineral water or filtered water that retains minerals can provide an advantage here. Let me address something important. Some men tell me they avoid drinking water in the evening because they don't want to wake up multiple times to urinate. I understand this concern, but here's what you need to know. If you're waking up 2, 3, 4 times per night, that's often not about how much you're drinking in the evening. It's usually about prostate health, sleep quality, or actually being dehydrated and your kidneys concentrating your urine. The solution isn't to stop drinking water in the evening. It's to time your evening hydration correctly. Have your last full glass of water about 2 to 3 hours before bed, then just sips after that if needed. This gives your body time to process the fluid while still maintaining hydration through the night. Now here's where this gets really interesting. There's a phenomenon called nocturnal polyuria, where your body produces more urine at night. This becomes more common as men age and is often linked to cardiovascular issues and poor circulation. Proper daytime hydration can actually help reduce nighttime urination by improving your overall cardiovascular function. Let me share some numbers with you because I know many of you like specifics. For a man over 60, you should be aiming for roughly half your body weight in ounces of water daily. So if you weigh 200 pounds, that's 100 ounces of water. If you weigh 180 pounds, that's 90 ounces. This might sound like a lot, especially if you're currently drinking only 30 or 40 ounces per day. Don't try to jump to the full amount immediately. Increase gradually over 1 to 2 weeks. Your body needs time to adjust, and your bladder capacity will actually improve as you train it with consistent, regular hydration. Here's a simple test to check your hydration status. Look at your urine color. It should be pale yellow, like lemonade. If it's dark yellow or amber colored, you're dehydrated. If it's completely clear all the time, you might actually be overhydrating, which can dilute important electrolytes. Now, I need to talk about what compromises this entire strategy: caffeine and alcohol. Both are diuretics, meaning they cause your body to excrete more fluid than you're taking in. I'm not telling you to give up your morning coffee or never have a drink. I'm telling you that for every cup of coffee or alcoholic beverage, you need to add an extra 8 ounces of water to compensate. Many of my patients have told me that their erectile issues were significantly worse after nights when they had several drinks. Alcohol doesn't just dehydrate you, it also temporarily impairs the nervous system signals necessary for arousal and erection. The dehydration component, though, is something that lingers into the next day. If you do drink alcohol in the evening, make sure you drink at least 16 ounces of water before bed. This simple habit can dramatically reduce both the dehydration effects and improve your sexual function the following day. Let me tell you about cardiovascular exercise and hydration because they work synergistically. When you exercise, you improve your cardiovascular health, which directly supports erectile function. But exercise also increases your fluid needs. If you're exercising without proper hydration, you're actually creating a deficit that works against your goals. Drink 8 to 12 ounces of water 30 minutes before exercise. Sip throughout if it's longer than 30 minutes, and drink 16 to 20 ounces afterward. This maintains blood volume and supports the cardiovascular benefits you're working toward. Here's something fascinating from recent research. Proper hydration improves endothelial function. The endothelium is the inner lining of your blood vessels, and it plays a crucial role in vasodilation, the widening of blood vessels necessary for erections. When you're chronically dehydrated, your endothelial function suffers. When you're well hydrated, your blood vessels respond better to the chemical signals that trigger erections. Some men ask me about supplements and hydration. Here's my take. If you're going to use supplements like L-arginine, L-citrulline, or other vasodilators, proper hydration makes them work significantly better. These supplements support nitric oxide production, which helps blood vessels dilate. But if your blood volume is low from dehydration, you're limiting their effectiveness. I also want to mention that certain medications commonly taken by men over 60 can increase dehydration. Blood pressure medications, especially diuretics, diabetes medications, and even some antihistamines can affect your fluid balance. If you're on any medications, talk to your doctor about how they might affect your hydration needs. Now let's talk about realistic expectations and timeline. If you start implementing this strategic hydration approach today, when will you notice a difference? Most of my patients report subtle improvements within 3 to 5 days. Better morning erections are often the first sign. More consistent erectile quality typically becomes apparent within 2 to 3 weeks. This isn't an overnight miracle, but it's also not something that takes months. Your body responds relatively quickly to improved hydration because you're simply giving it the resources it needs to function properly. Here's my challenge to you. For the next 14 days, follow this protocol precisely. 16 to 20 ounces first thing in the morning. 8 ounces every 90 minutes to 2 hours throughout the day. Front load before intimate activity. Compensate for caffeine and alcohol. Track how you feel, your energy levels, your erectile quality, your morning erections. I've had patients who thought they needed pharmaceutical intervention, who were considering expensive treatments, and they discovered that their bodies simply needed proper hydration to function as designed. I'm not saying this replaces medical treatment if you have significant erectile dysfunction, but for many men, especially those with mild to moderate issues, this is a game changer. Remember, your body at 60 doesn't work exactly like it did at 30. You need to be more intentional, more strategic. But the good news is that simple, natural interventions like proper hydration can have profound effects. Thank you for watching. If this information has been helpful, I encourage you to share it with other men who might benefit. And remember, better health isn't always about complex solutions. Sometimes the most powerful interventions are the simplest ones, consistently applied. Stay hydrated, stay healthy, and I'll see you in the next video.